infrastructure in our economy. Basically, there are two ways to look into the health infrastructure. The first is the primary healthcare infrastructure, which deals with all this type of diseases. For instance, uh, if you are having any asthma, if you are having cold cough, if you are having uh, any, let's say, typhoid, diarrhea, or let's say uh, stomach problem, or anything for which you don't need to be hospitalized, for which basically you need access to a doctor. And in the primary healthcare, in addition to these diseases, the only reason why you'd like to go is to at the time of your pregnancy, when for the childbirth, So typically, primary healthcare deals with this other diseases along with the childbirth thing. And as you know that in India there is close to 6,50,000 villages, and most of the villages, they don't have access to this healthcare, primary healthcare unit, And even then, uh, for the sake of reference, if you see one primary healthcare unit, what you will find is they don't have the doctors, they don't have access to medicines. Now, I'm trying to give you a macro picture. So in terms of primary healthcare, if I were to avail the government facilities, and why avail the government facilities? Because you will not see any private player who are operating in the primary healthcare sector. And the reason is very simple, because for the kind of diseases like I just now mentioned, be it asthma, be it cold cough, be it small time, let's say you have a jaundice, or even for during the maternity at the time of childbirth, if you are going to the rural area, because the per capita income is very low over there, people don't have monetary power, and therefore the private sector is not interested in investing in primary healthcare type of services. So basically what happens is this primary healthcare is primarily run by the government hospitals, and many times, unfortunately, the state of this primary healthcare centers are quite bad. But on the other hand, you also have what we call the tertiary healthcare sector, which is basically all these big private hospitals, for instance, Apollo or Fortis. So these are operated by big private players in addition to the government, because unlike in the primary healthcare space where you find only the government operating, and the reason why that happens is I just now mentioned, because there is not enough money to be made from the primary healthcare services. But on the contrary, if I am looking into the tertiary healthcare services, so anything that has to do with surgery, anything that has to do with organ transplant, for instance, if I want to get my kidney transplant, for instance, if my heart get blocked, I want to go in for a surgery, or for that matter, if I have some problem in my any one of the arms, So all these things, as you can understand, comes with lots of cost and comes with lots of money. And therefore, you see that in the tertiary healthcare system, you find the presence of private sector player, unlike in the case of in the tertiary healthcare system, we find the presence of many private players, unlike in the case of primary sector, where we find only the government operating. So that is the background with which I wanted to start. And also, nowadays we are living at the time of COVID, And I was just looking into the data today. As we speak, around 19 million uh, people who got affected worldwide. Sorry, this 19 million today is actually 36 million. So this number is a little bit backdated. And if I look into the number of death, there is now more than 1 million deaths. So this number is 36 million people now got affected because of COVID, with more than 1 million deaths. And the good or bad news in the context of India is, the good news is, in terms of mortality rate, COVID mortality rate, India has one of the least COVID-19 related mortality rate, meaning that people are getting affected even now as we speak. But in terms of death, people dying because of COVID, the numbers are quite low. And we are going to discuss why that is the case. Because as I said, the cause of worry is the poor state of health infrastructure. Most of the private players who are building the hospital or who are operating the hospital, they are in the, most of them are in the urban centers. Now, as you see that after this migrant laborers, they have gone back, and with all this festival season coming, we are now seeing the COVID number of people getting affected from COVID, that is again becoming large. But again, the good news is there are less number of people who are now dying because of COVID. Now, one thing you should understand and you should note is, there are other diseases where people actually die. For instance, if I look into the number of person who are affected in millions, because of tuberculosis, we have every year close to 3 million people who are getting affected because of tuberculosis. We have around 15 million people in India. So these numbers are even high as we are speaking compared to what we have seen in the context of COVID. So in case of cholera, again, close to 4 million people gets affected every year. And why I'm telling you these numbers related to cholera, or let's say malaria, because if I look into the sanitation part of India, India has one of the largest number of people who defecate in the open. So we have close to 600 million people. This is by the numbers given by the World Bank and OECD. You will find close to 600 million. To be precise, 557 million people who still defecate in the open. Now, I'm sure that you have heard about this government program called Swachh Bharat, or Clean India Mission, where the government already has built close to 100 million. So out of 557 million people who are defecating in the open, government has already built close to 100 million toilets. And yet people don't use toilets. So we did a study which is quite interesting. We wanted to understand that whether there is a demand for people to use the toilets. So all these numbers, these huge numbers, may come as a surprise to many one of you, because we cannot imagine to defecate in the open. But again, as I said, that 80% of India's population, they earn a income less than 1,50,000 rupees per capita per annum, and 1,50,000 rupees being our national average income. Now, very well you can understand the extent of poverty, very well you can understand the extent of people, the large number of people who live in the rural area still prefer to go out in the field. And there is this, we wanted to understand that why that is the case, and there are many study which has happened on this. So basically, there are, if you kind of see with the all India level data, you will find that again, number of people defecating in the open varies given the state you are looking at. For instance, if I'm looking into a matriarchal society, meaning that where a woman is the head of household. For instance, if I go to the northeastern part of India, or for that matter, if I go to Kerala, which is predominantly a matriarchal society as opposed to patriarchal society, what we see in the context of UP or northwestern states in India, you will find that in a matriarchal society, the incidence of open defecation is much, much less compared to a patriarchal state, which are in the northern states, for instance, UP, Bihar, Chhattisgarh, Madhya Pradesh, so on and so forth. What we also found, and this is also quite interesting, is if I want to divide the India's population in terms of religion, you will find, again, it was surprising to me as a researcher, that among the Hindus, the practice of open defecation is much higher compared to Muslim and Christian. And the reason again is in the Hindu religion, there is the system of the caste, So if you go to the Tamil Nadu, which is a very where caste is they follow the caste system quite minutely, you will find that in many Hindus, they are actually used to this practice of the lower caste Hindus cleaning their this thing, So because of that, we see that among religion, and in fact, the Muslims, on the other hand, they have this practice of offering ajan almost 5 times a day, and because of that, they wanted to maintain a very clean type of thing, and therefore we found that the prevalence of open defecation varies across religion. It is being higher among the Hindus, varies across what type of society we are living in. If it is a patriarchal society, then open defecation will be more. If it is a matriarchal society, open defecation is less. It also depends upon that whether you are living in urban or rural area, and it goes without saying that if you tend to live in a rural area, the probability of you defecating in the open is much higher compared to if you live in the urban area. Then also it also depends upon whether you are getting access to water, so there are some studies which showcase that even if you are building toilets and if the toilet does not have access to running water, people might not be using that toilet, So why I'm telling you all this thing about sanitation and open defecation, because this cholera that you see right now in the screen, almost 4 million people dies every year. And one reason for that to happen is when you defecate in the open, there is a likelihood of you contracting this disease, and people die because of this. Although this kind of thing you might not hear when you are living in urban area, but this kind of thing happens quite often in rural area. Why I'm mentioning about this number of people getting affected or impacted by tuberculosis, malaria, cholera, and road accident, because this other type of diseases that you see, which primarily come under this primary health care centers, which I just now mentioned, they don't get any attention in the national media, and yet people are dying, yet many people are getting affected, impacted. So there is a need to understand why is it that the COVID, for the first time, it is drawing so much more attention compared to these other killer diseases, which perhaps in terms of number of people getting affected, in terms of numbers, it's not that much different than the number of people getting affected by COVID. One reason for this is you will find that if I look into the Indian society, unlike the case of tuberculosis, unlike the case of malaria, unlike the case of cholera, as I said, if you belong to urban a well-to-do family, seldom you will hear that you yourself or any one of your family member, they are getting affected from tuberculosis, from malaria, from cholera. So this kind of disease has an asymmetric impact on the poor people, on the people who live in the rural area, on the people who don't have that much monetary benefit, So, and because of this, many times this kind of diseases, although it is impacting human life and livelihood, press or the media does not talk about this. On the other hand, if you see about COVID, because we don't have vaccine, and why the well-to-do family members in the urban areas, or for that matter in the rural areas, the well-to-do family members, they don't have this kind of disease, because if you belong to a well-to-do family, the very first thing that happens once you take birth is you are vaccinated, so you get all this different type of vaccine which kind of prevent you to get these diseases. Unfortunately, the rural poor, they don't have that much monetary uh, wherewithal for them to get vaccinated. And what I mentioned also, that in many primary healthcare center, they have a problem of supply chain, where they don't have this medicine, they don't have the required vaccine. And what happened is, ultimately, this poor children, this poor people, the children belonging to a poor income household, they are the one who are more vulnerable to all these diseases like tuberculosis, malaria, and cholera. And because it is asymmetric in the sense that they are likely to hit more the poor people, unlike COVID, because there is no vaccine, across the income strata, be it poor or rich, everyone is getting impacted, And therefore, so much of noise as how much deadly is this COVID virus. Although the matter of the fact remains that in terms of the mortality rate, it is still quite low, but it is quite symmetric, unlike in the previous case, which is asymmetric. And for the other diseases like tuberculosis, cholera, typhoid, malaria, these are likely to hit the poor people, the rural people who don't get access to proper healthcare services, don't get access to vaccination programs. These are the people who are more vulnerable. But unfortunately, uh, for these people, they are also getting impacted by COVID. But because their immune system is maybe strong, and why I'm using the word immune system, because if you see the people who are dying because of COVID, most of them, even in India, although the mortality rate is low, almost 80% of the people who died are the ones who are comorbid, in the sense that they also have other diseases. For instance, they have some respiratory tract infection, they have some, let's say, uh, lung diseases or kidney diseases. So these are the people, or they are diabetic. So these are the people who we say are comorbid, means there are more than one disease. And COVID is actually proving to be life-threatening for this type of people who are comorbid, who are above the age of 40 years, right? So that is the thing. So the fact remains that why COVID is getting attention, because right now there is no vaccine available. And secondly, which is more importantly, that across the world that we see, COVID is impacting, because there is no vaccine available, both the rich and poor similarly. Unlike the case of other diseases, which is impacting the poor more than the rich people. So this is quite interesting. I think as a student of sociology, economics, and philosophy, you should try to understand that how society react to a event which is impacting both the rich and the poor similarly. Okay, so there are some successful story as to how to contain the spread. For instance, if I look into the story for New Zealand and South Korea, they are very much able to contain the spread of COVID-19. And the only one thing that they did were they were just testing and isolating, because this particular disease has a lifespan of 15 or 14 to 15 days, and therefore they ask you to get yourself quarantined for 14 days. So if I can isolate the potential carrier of this disease, there is no way I can spread the disease, and therefore the disease died and the population recover. So that is the reason why this testing and lockdown is so much more important. Now, I just now mentioned that a large swath of our population, they live in the rural area. Now, if you see that India has nearly 1.3 billion population. Now, what is worrisome to note, 90% of the poor population we are talking about, maybe their number is around 350 million out of this 1.3 billion, 350 million people, they don't have, 90% of this poor, they don't have any insurance. Now, the previous class, I also said that 93% of the India's workers, they work under unorganized sector, and this worker also, they don't have access to insurance. So per capita, and this is also very startling in the sense that per capita spending on health in India is $75 per capita per year. And if you were to compare this with US spent on its citizen per capita $9,536. UK spent close to $4,396. In comparison to these numbers, India is spending only $75 per capita per year. Now, if I look into the availability of doctors, India has only 0.7 per 1,000 doctors available for its treatment. So when you hear that because of COVID, people are not getting access to hospitals, they are not getting access to hospital beds, they are not able to admit themselves into the hospital. This is because of the poor health infrastructure. So physician density in India is only 0.7 per 1,000 population, where the WHO mandate is 1 per 1,000 population. Now, bed availability is 0.9 per 1,000 population, whereas World Health Organization or WHO is saying that you should have at least 1.9 beds per 1,000 population. So you can very well see and understand, even in terms of the global standard, India lags behind when it comes to the state of health infrastructure. So not only our population are poor, not only most of them are not insured, but we are also not able to give them proper healthcare services because we don't have adequate number of doctors, we don't have adequate number of hospital beds where anyone can get admitted. Now, and this number, 70% of India's healthcare expense are out of pocket expense, because the government of India, they spend quite low. If I look into the central government, again, health is a fall under concurrent list. So you have both the state government and the central government spending on health. Now, if I look into the central government, how much they spend on health, you will find that central government is spending only close to 1.5% of national income on health. If I take both central and state government together, the number comes to around 4.5% of national income. So that is quite low in comparison to what you see in the developed countries. Now, even for people like us, people like you, or most of you in the class, you will notice that 70% of our healthcare expense are out of pocket, meaning that when we go to any outdoor, no matter whether you have insurance or not, you have to spend from your pocket because that thing is not insured. Let's say I go out for, uh, I have, let's say, uh, some sore throat and I had to visit a doctor. The amount of money I spend is again not insured. It is, although I have got insurance, but 70% of the healthcare expense are out of pocket. Now, because of this poor state of health infrastructure, we see that in case of India, the infant mortality rate is so high. So for India, the infant mortality rate, and the way we are defining infant mortality rate is how many death happens per 1,000 live birth. So every 1,000 live birth, how many infant dies before they attain the age of 1 year. So for India, this number is 37. Now for developing countries, this number is less than 5. So you can again understand this disparity. Most of it is happening because of the poor state of health infrastructure. Now we tried to do a simple study. We tried, and this thing that we tried to do is back in April, and we actually projected back in April as to how many number of death will be there, or how many number of people will be affected. So what we did is we controlled for the population, and the way we controlled for the population is, as you can see, each one of the state, for instance, Germany has got similar population to that of West Bengal. Spain has got similar population to that of Orissa. So on and so forth. So each one of the state, we tried to map with another country, and we wanted to see that if these states were to test in proportion to what is being done in the developed country, then what would be the number of people getting affected. And as you can see, this thing was done way back in 19th April. Almost, now we are in October, so almost 5 months back. And at that point of time, you can see these numbers is actually now the numbers that we are seeing. So it is very easy to project. It is very easy to predict how much more people. So our analysis suggested at that point of time, although the number of death, so we kind of estimated around 80,000 death, but now it seems that the number of death will be much more than that. We predicted close to more than 10 to 11 lakhs people getting affected. Now, of course, again, the trend is suggesting it may be beyond that. But more or less, the numbers are similar. But what is more interesting to note is for India, the mortality rate is very low, is quite low. And why, if you think why the reason that the mortality rate in India is low, one, and these are again coming from the various study which has been undertaken in various parts of the world. What the studies are pointing out is in tropical climate, the impact of the virus will be less. So when the temperature is below 3 degrees Celsius, then the number of COVID-19 patients, that number increases by almost 5% for every 1 degree Celsius fall in temperature. So for India, as you can understand, thanks to this hot summer weather, tropical climate, which is also hot and humid, which is something the virus don't like, or something the virus cannot survive in hot and humid climate. And therefore, you see the number of death in India not only in India, if you look into Bangladesh, if you look into Pakistan, if you look into Sri Lanka, if you look into most of the African countries which are in the tropical or the near equator, there the number of death is very, very low. And the reason is again very simple. Virus, they become relatively ineffective if you're having a hot and muggy weather, So under hot and humid condition, the 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 virus become less impactful. The other thing which scientists are now, of course, this is not has come in any research paper, but people are talking about it, and even the government of India, they have opened a department. It's called Ministry of Ayush, where basically saying that there are various that Ayurveda type medicines, Ayurveda types dietary habit, which contains various phytocompounds, which are in a way antipyretic, meaning that if you take this herbs, if you take this food or fruits, then the phytocompounds present in these herbs and fruits and food can prevent you from COVID. For instance, in Tamil Nadu, if you go, there they have this habit of taking rasam, and the Ministry of Ayush and some other this came out in a paper in one of the Ayurvedic journal. They are claiming that because of the content which is there in rasam is antipyretic, and it will help you not to contract any disease, predominantly cold, cough, and fever or COVID related disease. So, and there are also some studies which have mentioned that if you have taken vaccination during your childhood days, so all this BCG vaccination that you take to prevent yourself from having tuberculosis or other diseases, that in a way has helped to build your immune system strong, which also is helping one not to contract this disease. So, but actually in case of India, if you see, one of the most important thing is we have a very young population. So if you look into the demographic profile of India, most of the Indian people, I think the median age right now is 29, which means predominantly the Indian population is young. And if you are a young guy or a girl, you are less likely to be comorbid. And if you are less likely to be comorbid, you are less likely to get affected or maybe die from COVID-19. So that is the reason why we see that in case of India, of course, these other factors also played an important role. For instance, hot and tropical climate, then your BCG vaccination, then all our dietary habit. In fact, there is also some study which showcase that if the level of pollution is low, now because of lockdown in the month of March and April, you will notice that the level of pollution also came down drastically in India, because no car, no trucks, no bus, nothing was operating, because transport came to a standstill, and because of which the pollution level, particularly in the city of Delhi and other metro cities, it came down drastically. That also helped people not to get that much impacted from COVID. And the other thing which also went in favor of India is, unlike in the West or in any developed countries that you go, for instance, if you go to US or Western European countries, if you're working, everything is in a controlled environment, in the sense that if you're working, if you're going to school, colleges, everything is centrally air conditioned. The car that you're driving, it's again air conditioned, So it's a closed, controlled environment. So the probability of the disease spreading when you are working in a closed environment, which is under air conditioner thing, is much higher, because the virus can spread because already the temperature is low. As I said, the virus become active under a low temperature, but also it can spread through the air ductile, which is part of this centrally air conditioned system. So that kind of thing we don't see in case of India, because in India most of the time, for most of the people, we are used to working under an open environment. So that has also helped for us not to uh, get that much affected by the COVID-19 virus. Now, the problem is this lockdown that has impacted the economy. So that is something also you should understand, that although India has a not that great health infrastructure, although we have a deficient number of hospitals and hospital bed, we don't have that many numbers of doctors to treat us, and yet the COVID related death in India and elsewhere in the tropical region are less because of these factors which I just now stated, primarily because of young population, primarily because of our dietary habit, and primarily because of the climate and weather condition. But unfortunately, government wanted to go for lockdown because they wanted to control this during the initial months, but that has cost us dearly, because now you can see that the unemployment has rose to all-time high. We have around 122 million people who have lost their jobs, and most of this group are the ones who fall in the migrant labor categories. So this is what we are saying. So daily, India, and this number is at the time of lockdown, daily Indian government was losing close to, not the Indian government, the Indian economy was losing close to 56,000 crore rupees per day. The total estimated loss is around 10 lakh crore rupees. And when lockdown happened, the size of the Indian economy is close to $3 trillion US. 80% of the Indian economy just came to a standstill. So this kind of explained that why we saw that during the previous quarter, our GDP shrank by 24%. So this is the reason. Now, again, the good thing is we are actually, if you look into the stock market, if you look into most of the corporate earnings are again back to normal, in the sense that people are anyway have to buy consumer goods, be it FMCG product, be it consumer durables, they have to buy. So all this FMCG industry, for instance, Godrej, Britannia, Tata Consumer Product, Bajaj, so most of them are back to now pre-COVID level, when it comes to the amount of business which is being done. But what is need to happen going forward is we should also try to, because many people have gone back thanks to this lockdown. So are there any way the state government, the individual state government, can map the skill of these workers who have returned back and try to employ them in the state, so that until this pandemic end, they don't have to return back to the place of their work. As you know that most of the migrant laborers, they come from the state of Bengal, they come from the state of Orissa, they come from the state of Chhattisgarh and Bihar. These are the poorest state in India. So ideally, the government should try to map their skill and try to see, because when you are looking into the how to handle COVID, there can be two type of model. One is the Bhilwara model, which is saying that strict lockdown. Now, Bhilwara is a district in Rajasthan, you may have heard, which went for strict lockdown, and that's how they control the spread of disease. But that is going to impact our life and livelihood. Uh, livelihood, to be more precise. Life, maybe you will be able to save, but not livelihood. You are going to lose the job. The other is the Orissa and the Kerala models, where basically they are saying that they are actually through this uh, Aragya Setu app, they are trying to demarcate this zone, various zone into green, orange, and red zones. So they are trying to see that in the green zone, at least you can allow the economic activity to happen, so that you can get the economy part of it up and running. So that is what. But now I think economy has started to open up slowly, and maybe by next month or so, we are going for herd immunity. Herd means HERD. Herd immunity means if your 60% of the population they get impacted by the virus, the virus cannot spread any further, and it will have its own natural death. So the way the number of COVID cases are spreading in India, I think within next 2 or 3 months, we are going to reach that stage of herd immunity. And my belief is even before the vaccine comes, in India, we will develop this herd immunity so that the number of no one no one else will get affected or impacted. So I will stop here and let me entertain a few questions. And so please